glorious Edo. You're the heartbeat of Nigeria. Beautiful Edo, glorious Edo. Stars are singing over you. You're the land people dream to be.
What about those things there? But who's supervising the property? Who has responsibility for it?
It's council. Council.
The people behave as if government has done nothing. Look at it. There's a facility here, it's not being used. So what is the responsibility of council? Just to play politics. I gave you 90 days. If this place doesn't work, you cease to be the local government chairman. Because there's no purpose. You're not adding value to the people. The issue is not intervention of what government has done or not done. It's what let's ask those people who have the responsibility to provide services. Well, let's ask them, begin to interrogate and question them.
The challenges are numerous. Like number one, we don't have light in the health facility. We are lack of drugs, except we buy. That is when we treat patients. We don't have a pharmacy. You can see that this office is jam-packed with drug cupboard and everything. Even when you get to the ward, we see that we don't have mattresses, we don't have pillows, we don't have bed sheets, and we don't have security. It's a big issue.
They don't have good facilities for like people we have like all those accident victims, all those things. You cannot post of taking them there for proper treatment. There's no water. No water. It do affect them too. They don't have water.
The healthcare centers are, majority of them are in a very bad shape. We need a massive renovation.
The function, what is the say, give me like this, you're supposed to open down, you don't open down, they should open down their house. Because the workers, the distance, too much. So they wanted to come here.
Edo State ranks heads and shoulders above many other states in the country as a technology-driven state. With its fiber optic infrastructure, governance has become more efficient, cost-effective with a well-trained workforce. This has led to innovation in the delivery of amenities or services to the people.
When we came in, you asked how many hospitals are there in Edo State? How many doctors? How many pharmacies? How many physiotherapists? You couldn't go to one central place to even find out. So data, which is key to planning, was missing. So what we've done in the last 7.5 years is to sit back to rethink healthcare. From the time you are born till the time you die, what are your healthcare requirements, and who are the people providing these healthcare requirements in Edo? And if they're not there, what do we do to make them available? The healthcare system we met in Edo was one that was dysfunctional and chaotic. Hitherto, when people talk about healthcare, they think hospitals alone. They don't think about a system. They don't think about the process. They just think that when you talk about healthcare, then government's healthcare budget is about how to fund government hospitals. But healthcare, as we came to find out, particularly as a result of what happened during COVID, was beyond just government hospitals. For government to limit its supervision or participation in the healthcare system to just a few hospitals, a few government-owned hospitals, meant that a lot of people were excluded from the healthcare system. All schools are to remain closed in Edo State until further notice. Public transportation will remain in operation. However, crowding in commercial vehicles should be avoided. It came out during COVID that we didn't have data. For instance, I asked, how many people have died as a result of this pandemic? You had conflicting information.
Under the visionary leadership of Governor Godwin Obaseki, Edo State has embarked on a transformative journey to revolutionize healthcare delivery. The Edo State Health Improvement Program or EDOHIP, aims to provide all residents with efficient, effective, and sustainable quality healthcare services.
Like I said, it was clear that healthcare was so important, it was too important to be centralized. And for us, because of the large population in the state, we felt that healthcare should be brought close to the people. And you should not have to travel very long distances to a central location to get care. You should be able to get care in your community. So to demonstrate our seriousness, we had to move in there and to just shut down the central hospital while investing and building community health centers.
This administration has been able to walk the talk. It should be noted that the success of the reforms and policies is hinged on technology as a driver of the process.
Over the years, we distorted our system. Whether culturally, whether wrong beliefs, and we started navigating our health system through diverse routes. We started navigating our primary care systems coming from the top rather from bottom up. The referral system was broken. And so that's what the governor is trying to correct.
As you can see, this is a New Era College, and the project that is going on here is a primary health care center. A project that is being put together by the state governor who has the interests of the people at heart. I think it's not easy to come by such governor who want to bring healthcare delivery closer to the people.
At the heart of this initiative is a commitment to strengthening primary and secondary healthcare services, ensuring every citizen has access to essential medical care through comprehensive health insurance schemes, integrated telemedicine, and emergency health services.
Somebody told me that this one is health center, so I like everything that they do here because we not get health center around this area before. We dey go very far, like New Benin, down Cemetery Road. So I did very, very happy for this center when they put for here. At least people always see they like extension. They'll say they come this year and they're very happy. So I'm very happy. So we get this center here. We thank the Governor Obaseki. We thank him very much.
One of the things most governments have done to reduce the cost of care is to make sure that you undertake measures to identify ailments in their early stages and not wait until it has become critical. And so it is much cheaper for the system to train your healthcare workers to follow up on patients at an early stage. So once you come into your facility and they know that you've come to report a particular ailment which they need to check. If then the healthcare workers, that's why you have the community healthcare workers there who are trained to follow up with you and follow up the treatments so that they don't bring you in when it's too critical and too expensive.
Considering the economic situation in the country today, getting Medicare can be financially excruciating, especially for the low-income earners.
You see, healthcare is not cheap. That is first, so we must know. But in the past, we've, as government, have always tended to believe that we can foot the entire bill for healthcare in the state, and it hasn't worked. And most people know, so they just go and try and get care privately. And because of the expense of just paying out of pocket when you're ill, most people shy away from going to seek cure. With the health insurance scheme, it's a scheme we put in place, and where by just ensuring that you pay little premiums on a monthly basis or periodically, you are covered. Now, when you go, the day you're fortunate to be ill and you go into any care, any facility, any hospital, whether private or public, that is enrolled in the scheme, all you need to do is present your card. And what you need to now deposit or pay will be very, very little compared to the cost of the care you have received.
Prior to 2016, the out-of-pocket expenditure for Edo State citizens was at 90%. And what that means is that out of 100 naira that someone needs to spend, an Edo citizen needs to spend on healthcare, 90 naira out of that 100 naira comes from his pocket. So the governor set up in 2019, created the Edo State Health Insurance Scheme, which is a way to finance health and make healthcare accessible to everyone in Edo State.
What is the sustainability of this laudable program, which has not only improved access to medical care, but also at a minimal cost, with a percentage of this cost borne by the state government?
Edo State Health Insurance is signed into law. So whether we dey here, we not dey here, whether this government dey here or we not dey here, Edo State Health Insurance will survive. And we don't put structures in place, processes, such that the thing go dey work, so that private public fit give people care. And if everybody enroll into the scheme, it means that we will get more money to take care of more people. It means that many health service providers will get money for their hand. So now win-win situation for everybody. For those who enroll for the scheme, for people where they work for the commission because their aim not to achieve universal health coverage. And even for the health service provider across board, whether they be pharmacy, whether they be diagnostic, whether they be nurses, across board, this health insurance is good for everybody. I use this opportunity to call on all Edo-lites to please key into the initiative of our Edo State government and come and join our health insurance scheme.
You never know when you'll be ill or when something will happen to you or your family. So it's always, so that's why this scheme has become so important, that for as little as 50 naira a day, or 18,000 naira a year, you're covered. I'll give you an example, a story I heard of a young man who was enrolled into the scheme. He works for government, but he's a unionist. He went in for delivery, took the wife into one of the hospitals for delivery, and the wife had to be delivered via cesarean section for twins. He was contemplating running away because he didn't see how he could, afford to pay, for the treatment. And he summoned up courage and went, to discharge the wife. And when he got there, he said, "Where's the bill?" You won't believe, something that would have cost in excess of 100,000 naira. This man got a bill of only 3,000 naira. He could not believe it. He just could not believe it. He said, "No, you're covered by your health insurance. So, and this is what you should pay. This is the out-of-pocket you should not pay." So it's those sort of impacts. And so today we have almost 300,000 people enrolled. Our target is about 1 million to make sure that we enroll at least a quarter to a fifth of our population, so that the scheme has a solid base to continue to be sustained.
So this Ubekun Health Center, I come here. So immunization, antenatal, every other health issue that they attend to us if we come here. We know they pay for some. Now only some, maybe you want to buy drugs. When they say it's there, maybe now you feel back. Anytime we come, whether at night or that they attend to us.
My good people of Edo State, I bring you good news from the stable of Edo State Health Insurance Commission as regards the good benefits brought to all Edos in the aspect of good health and quality living. Are you a doctor, lawyer, farmer, mechanic, market woman, or school children? This information is for all because it's about our health. Registration requires a token to enable you with sex quality healthcare. Edo State Health Insurance Commission is available to you in every hospital around you.
Contact us at 8th floor Block B, Civil Service Secretariat, Supply Road, Benin City. Top floor, Cordelia Agbe Baku Hall, AAU Ekoma. A second West Local Government Council Secretariat, Auchi. 19A Central Park, Obakamayi, Benin City. You can call or chat us on 08139 833 or 08073060807. Website www.edostate.edohis.com.
This information is brought to you courtesy Edo State Health Insurance Commission. Grab this opportunity to safeguard your health.
If you're a recent graduate from Edo State looking for your first job in tech, this one is for you. The Edo State government is looking to train and employ 150 exceptional people to join the state workforce to manage the tech revolution in Edo State. This world-class IT training program to be delivered by Africa's leading tech institute, Decagon, in collaboration with Green Zone, is free of charge. Under Governor Obaseki's leadership, Edo State has been making waves in the tech sector, laying almost 5,000 kilometers of fiber, the second most in Nigeria. Digitalizing Edo State government operations, setting a gold standard for efficiency and transparency in governance, and launching Edo Tech Park Initiative, the new home of tech in the whole of Africa. Edo State is on a mission to shine brightly in the digital age, and we need the most brilliant young men and women to build on the digital foundation that has already been laid. Are you ready to join us on this exciting journey? Apply now for the Edo State IT Professionals Training Program. Hurry, spots are limited.
Looking at the various investments by the state government in the healthcare sector and its innovative approach to providing healthcare to its citizens, Edo is gradually becoming a model state as a healthcare hub. It begs the question to know what the attraction that has brought in specialists and investors in the healthcare sector is.
We've not just put buildings, we've not just put in processes. We've also ensured that there's a system. And key to that system are the people, changing and reorienting them to know what to do. So today we revamped nursing schools. We are revamping health technology schools to provide the critical workforce.
When we came on board, after the complete rehabilitation, renovation, and remodeling of the college, it was heaven on earth. The school from the gate is Wi-Fi enabled, and then from 100 students in 2021, today we have about 960 students on campus, both doing their ND and RON programs. Like you may also know, the school last year got accreditation from the National Board for Technical Education to commence ND, HND programs. And we are glad that we have complied with all that is needed to make sure that our students are fit as 21st century nurses.
Important thing in building a healthcare system is the people. And so our emphasis has been on focusing, making sure that we train skilled people at every level, not just the doctors. Because how many doctors do you really need? The doctor will come in, consult, perform your surgery or whatever. Then what happens? Now leaves that patient to a whole retinue of healthcare workers that need to follow up with you.
What we are doing really is to take on the vision of His Excellency to run this program as an international school, because we are producing nurses and midwives for not only the Nigerian market, but for the market abroad.
Ditto the School of Health Technology, which trains staff for the primary healthcare system. So you're building all these 200 primary healthcare systems across the state. Who's going to man them? Who's going to make sure that the quality of care you want is provided in those centers? But more importantly, our focus is on job creation. And you know the kind of jobs available in the healthcare system. So we're training. So for those who can't find opportunities or placements in our system, we've created, made them qualified enough to be able to get jobs anywhere else in the country.
We are looking at the best practices in nursing education, in healthcare, and we are putting everything all in place in order to develop our curriculum based on what is the standard. And so the way our thing have been, and with His Excellency's initiative and mandate, he actually surpassed the minimum requirements.
Well, the facilities all around are really good, and it's affordable, and even the e-library itself, we have e-library that we can access to easily, not us going out to get some books that we really need, and we also have to pay. But this one, we just have to sign our name and go there and collect the books, then bring it back when you are told to bring it back.
This school has provided us with nice hostels, beautiful hostels. We have almost 24 hours of light, and we have a dining room where we can eat whenever we buy our food. We have a chat room where we can chat with our friends without going to the rooms to disturb, and it's regulated and it's very clean.
Looking at the various investments by the state government in the healthcare sector and its innovative approach to providing healthcare to its citizens, Edo is gradually becoming a model state as a healthcare hub.
So the fact that we now have a system that cares, a system we can monitor, and we're able to do this because of technology. You know, we have under the Edo Health Improvement Program, for instance, we have a centralized database. Because we have a central healthcare database, if you travel to another location in the state and you are fortunate to fall ill and they take you into one of our facilities, your records can be pulled up easily in whatever location, particularly if you are registered under the health insurance agreement.
Technology has been a core of governance for the Governor Obaseki's administration right from the beginning. This has led to innovation in the delivery of amenities. One of such is telemedicine.
Chima, where are you?
I'm at home.
Where?
I'm in my house.
In where? In Benin or in Agbo?
In Benin here.
All right, so Chima is far away. So in our typical facility, this appointment has been scheduled, and at that point in time, I'm consulting with Chima and a patient right there. So I'm going to ask him, for instance, Chima, how are you today? What's your complaint? Do you have any complaint? I'm Dr. Idemudia.
Yeah, good afternoon, Dr. Idemudia. My name is Chima.
Okay.
I came the other day, so I was asked to return and come back for the telemedicine registration. So I have a little pain in the back of my head.
Okay.
That was the reason why I came.
This pain, when did it start?
Well, it started about 3 days ago.
So does this pain move to any part of your body? Does it move to your hand, or it just remains there?
No, it just remains there. Whenever I bend over, it intensifies it.
It intensifies it. What we just witnessed just now was demonstrating our what we call telemedicine. So what it means is that I'm able to sit in my office and schedule a section with my patient in another health facility where perhaps there are no doctors there to attend to the patient, or perhaps they need my particular specialty in managing that particular patient. So what that does for me is that it helps me to be in 5 places at the same time. So that's the beauty of what we are doing. And right now, most of our DG clinics, what we call DG clinics now, and this will help us to cover that gap in terms of human resource.
What we're doing now is that we're connecting fiber optics to some of our facilities. I can sit in the comfort of my office now and consult in Agenebode clinic, such that that gap that was there before, that gap that there's no doctor there, I'll bridge it. Agenebode is even good. Akoko Edo or somewhere, all right, where no doctor would have been. But guess what? Our fiber optics has gotten there, our computer has gotten there, our alternative light has gotten there, so I can consult. In fact, we're about to launch our initiative on that, which is 1 hour, 1 week, 1 love. Let me explain that. 1 hour of a doctor's time. A doctor that was trained by taxpayers' money, who has jackpot to go look for a greener pasture. Just give us 1 hour. In that 1 hour space, we will schedule you to see 5 to 6 patients, and then you go on your way.
This administration has launched the Edo Emergency Medical Service, EMS, for emergency medical response. EMS ensures immediate, high-quality care, making Edo State a leader in emergency healthcare.
2-3 months ago, we launched the Edo Medical Service. Just last week, we had over 27 emergency calls to our center. which were responded to. And people are beginning to have confidence in the fact that, yes, there's a number, 112-739, that they could call during an emergency, and then the response will come their way. So you can see that the governor has touched every aspect of the healthcare space that is needed to have an all-round package of healthcare for the citizens of Edo State.
You see, I think emergency response is also very critical in the healthcare system, because at any point in time, anything can happen. And, you know, most of the time, if they can get to you early enough, right, and administer the first aid, or, you know, to you at that point of, you know, at the point of the incident, whether it's an accident, whether it's a seizure, whatever it is, once we can get to you and there's a first responder that gives you that emergency response or treatment, then the possibility of stabilizing you and getting you to a point of care is a better chance of survival through the emergency response system. You know, we have, you know, a command and control center here. A call comes through, we identify the location, then within a specific time, and the closest responder around is informed and reaches you.
So usually, if you have a cold case, you wait till the next morning and be attended to by your doctor, isn't it, in your primary care? But if it's an emergency, you call 911, or in Edo State now, 112 or 739.
So what we have done and what we're doing on our health improvement program is to make sure that the Ministry of Health now plays that regulatory and supervisory role it is supposed to play. So whether you are public, you are private, there are certain standards, minimum standards you must operate so that, you know, it doesn't matter where you find yourself. You just know that you cannot get below a certain standard of care. So the Ministry of Health now ensures that every health facility is inspected, is properly registered and regulated. If you are supposed to have 2 nurses, they go there to make sure that those 2 nurses are qualified to be in a hospital. Otherwise, they penalize you.
What is the confidence that a legacy is being left behind in the healthcare sector?
When you look at the healthcare pyramid, the base is a primary healthcare system. And that is what we are focused on. And then your referral specialists center. You know, what we're doing with the Stella Obasanjo Hospital. And we're lucky that at the tertiary apex level, we have federal government investments and institutions to provide those care. So we are blessed in Edo that this pyramid is perfect. What we needed to do as a government is to make sure the base of the pyramid is solid. And that's what we've done in the last 7 years.
Healthy people, wealthy Edo.